Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So, causes of heart failure. Heart failure can be first, whenever there is heart muscle disease, can cause heart failure like ischemic heart disease or in cardiomyopathy. Ischemic heart disease or cardiomyopathy. In ischemic heart disease and cardiomyopathy, there is some disease in the heart which can result in heart failure. It can be due to restricted filling of the heart. In conditions like in restricted filling of the heart, conditions like constrictive pericarditis or restrictive cardiomyopathy or conditions like cardiac tamponade, all these are responsible for restricted filling of the heart leading to heart failure. Because obviously if there is less filling in the heart, then the heart has less blood to pump, so there is less blood pumped out of the heart, thus resulting in heart failure. Then we have inadequate heart rate. Inadequate heart rate can be due to drugs like beta blockers can cause inadequate heart rate, or it can be due to the heart block. There can be inadequate heart rate. Whenever there is inadequate heart rate, this can also result in heart failure. Or there can be conditions of excessive preload. In excessive preload, there is fluid overload may be seen. This fluid overload may result in left ventricular failure in a normal heart. When there is left ventricular failure in a normal heart due to fluid overload, this can also is a cause of heart failure. Okay, then there can be one more. There can be chronic excessive overload. Chronic excessive overload of the heart on the heart can be seen in conditions like aortic stenosis and hypertension. In conditions like aortic stenosis and hypertension, we can see chronic excessive overload on the heart. So all of these will result in heart failure.
thank you and thank you for watching.